You have so many amazing speakers today, people who are on the ground breastfeeding their babies and helping other women to do it. I really had to reflect and say, okay, so what is the value add that I could bring to this conversation this morning? And what I decided I wanted to do was to just give a few challenges. We are no longer having to convince people writ large about the value of breastfeeding. People understand that it is important. We haven't seen news stories in the last, period since our last convening where they're, taking this social argument about it really is a social choice, It's clear with all the support from pediatrics and obstetricians, and to a greater degree, it's coming from gynecologists that are really steeped in the science now, and they really understand that this is something that is important to the health of the baby and to the health of the mother. So we've got reason down pretty much, and we've got the research down, pretty well. So the next horizons for us are different than they were 2 years ago, 3 years ago. This is really now about creating policies in this country that support women to do this. Now, women are in the workforce now. So the real strategic ally and partner in this has got to be the workforce in ways that they haven't been before. It's got to be business. And so I would say one of our biggest challenges right now is to get, I love that term, B-suite, but I'll say get the C-suite folks in the room and get them to make solid commitments. And there are C-suite folks at McDonald's, at Kentucky Fried Chicken, at Walmart, at all of those service employers who we might not ordinarily bring into this conversation, but they have to be at the table. And they have to figure out how their work environment can become conducive and supportive for families that are nurturing their children, breastfeeding their children. Our policy debate is one that amazes me that we are so obtuse as a country. We're probably the only really wealthy or developed country that doesn't allow adequate leave, that doesn't support, that doesn't support women and families in this critical phase of life. Now, there's a new report that was issued by the Institute of Medicine. One of our grantees, Stephen Wolf, was the key leader of that work, and it's called Shorter Lives, Poorer Health. And the data it presents is astounding as to how poorly we are doing as a nation in terms of health outcome in comparison to our peer nations. But perhaps the most striking statistic that emerges from that report, as well as trend data, is that women in this country are dying younger and are facing more health challenges than any other population. Women are experiencing the poorest health. Now, how can that be? One of the reasons is the less than optimal breastfeeding rate. But another reason is that we haven't created a culture that respects and honors the complexity of pregnancy and childbirth and child rearing. And so this idea that women should have babies and go to work next week, it's an outpicturing of that lack of respect and regard. Now, we know the complicated history of the women's movement in this country, and many women fought to get out of their homes and be in the workplace. But now, women are trying to do everything, be in the workplace and raise the children, and do so without adequate supports. So I would challenge you to see this crisis in women's health as directly related to this movement and work harder to get the changes that we need in policy to support women in their parenting and nurturing role as mothers. Now that means engaging fathers in new ways. And I'm so happy to see men in this room. It's one of the breakthrough components of this work. We're engaging fathers, but we're not researching fathers, and we're not listening to fathers. And we have to do that. We have to have a creative strategy that allows fathers to tell us why they aren't adequately engaged in this, to challenge their assumptions and the things that they believe. And we need to bring fathers into this work as true partners. Now, you know there's been movement in this country for the first time about the plight of young men and boys of color. Our president stood up. Thank you very much. But I challenge you not to be the echo in the room that says, "What about us?" And you know that's happening. We have people saying, well, why is it focused on young men and boys of color? What about the women? What we've learned in our racial equity and racial healing work, it is not either or. It is inclusive. It is both and. And so I challenge you to keep that mindset and recognize that the horrible violence that our young men and boys of color face on so many levels in our society is an outpicturing of racism. Now, unfortunately, the movement has not been explicit yet about racism as a factor in this dilemma that our young men and boys of color face. But I ask you to connect with that work in a way that is productive and that pushes the agenda forward on behalf of our nation's children. Because most of these young men and boys of color are fathers, okay? And when they are in jail and when they are killed, the children are left. The mothers are left. The partners, the wives are left. Now, I said my topic would be social determinants, breastfeeding as a social determinant of health. And I want to touch on that briefly, because what the social determinant framework has allowed us to do is to realize that health is an everyday reality. And when it isn't, we need medical intervention. But it is the circumstances of every single day of our lives that really creates our health and well-being. Breastfeeding was intended to be one of those circumstances of our early lives. The introduction of mother's milk to the newborn is as essential as the placenta is to the development in utero. It's just that basic. So it is a social determinant. And most importantly, and this is what I try to really drive home when people talk about social determinants, because they really left racism out of that initial frame. We talked about housing and education and access to health care and the environment and food, and for a long time, nobody really focused on racism as one of those social determinants. But it is, in fact, one of the social determinants. And how breastfeeding connects to that: breastfeeding, social support, healthy air to breathe, quality food, spiritual beliefs, all of those things help us to mitigate the exposures, the consequences of the exposures to racism and discrimination. We're going to work to eliminate structural racism. We're going to continue that work. But while we do that work, all of us are experiencing it on a daily basis. And so how we balance and mitigate the negative effects of that exposure is by shoring up our immune systems and optimizing our body weights and quieting our stress responses. We do that through our relationships. And I don't think there's a more important relationship than the relationship of the mother to the newborn infant in creating the capacity to withstand the stress of growing up in a culture that is steeped in the absurd ideology of a difference in the value of human beings. We are all equally valuable. We haven't gotten there yet as a country. We don't know that yet, but we will. We will someday have a country that is completely different in its distribution of opportunity, its distribution of education, its distribution of resources. And so the last challenge I would have for you today is to ask you to really imagine, what will this country be like when our work is done? What will this country feel like when our work is done? Because if we can't imagine it, we can't achieve it. But I know all of you in this room can imagine it, and I know you can inspire the media, the communications industry, the mayors and the CEOs and your neighbors and your faith leaders, your ministers and your teachers. You can inspire them to imagine a different America. America in which nature is honored and respected, and every child that can gets access to its mother's milk, and those women feel supported and loved by their partners and by their families and by their communities. This is our work, and one day we'll look back and we'll say, wow, can you remember when? Now don't be fooled by the progress. We have made progress, but we are a long way from where we need to be. The fact that we have high initiation rates, and we have high rates even at 3 and 6 months. What we don't have is exclusivity. And exclusivity makes the biological and biochemical and physiological difference. That's where the benefits accrue. That's a whole nother talk. But I just don't want you to let folks look at the data and say, well, what's the big deal? We're making progress. We are not where we need to be, but we will be there. And the last challenge, I said the other one was the last, but the last challenge, I just left Grant Makers in Health. We have got to bring other funders into this conversation. The government is playing a role, but we need a bigger role from philanthropy. So I ask you to go back into your local communities and find a way to engage your local philanthropy leaders in supporting this critical catalytic intervention that will not only save billions of dollars, but it will save lives. Thank you.